1200. Well, I'm so excited. It's been a very difficult weekend also for us. Women and children of all ages were murdered and mutilated. Over 200 Israelis were taken hostages, including two very active and pivotal occupational therapists, Carmel Gat, which was my employee just right before she was kidnapped, and Keith Sigal. I used to know both of them. Hopefully, with God's help, they will return back home safe and sound. We deeply appreciate your guys' support and the desire to stand with us on these difficult times. We welcome your willingness to take part in the clinical activities of OT throughout Israel in the variety of fields. Your sincere offer to participate and promote the activities of ISOT are warmly embraced. We hope that this bond will prevail and thrive even after the war, with God willing, end soon. Thank you so much for taking care. Thank you for the panelists who were willing to share their work with us and you guys this evening and morning. Thank you for being with us today. I'll put also in the chat the ISOT mail, formal mail if someone would like to be in touch with them. So thank you so much. And Tamar, let's start the evening.
Thanks, Aya. I'm going to start tonight with Liat Gafni-Lachter, and we'll leave the introductions to each of you. You can tell us where you're from and what your background is.
So hello, everyone, and thank you so much for coming on this Sunday or Monday. The support is so appreciated. I'm here in Haifa, Israel. I'm an occupational therapist, of course, and I work as a lecturer in the post-professional program at Boston University, and also as a pediatric practitioner. Today, I'd like to share a timeline of the early events that happened in the OT community in Israel and the world, a piece of it, our initial community mobilization. And let's begin. Actually, a long time ago in August 2022, that's the WFOT Congress, where I and many colleagues were first introduced to the idea that occupational therapists have a role in disaster risk reduction and preparedness. And for many of us, it was the first time thinking about it. It was related to lessons learned from COVID and also practicing and progressing towards challenging climate changes. However, the key lesson learned was that occupational therapists have a pivotal role in disaster prevention, response, recovery, and rehabilitation. That time I thought, this is such an important role for us, and we should start to get active in it. Little did I know that will become such an important pillar. So October 7th, there's still not enough words to describe. This is a picture from Kibbutz Be'eri. On that day, I think so many conceptions were shattered regarding our roles, our life, our security, our purpose. And the first thing that people did was to find something to do. Anyone that was able began to look for an occupation that has meaning and purpose, whether it was to collect food, donations of money, of blood, of opening homes, finding shelter for others, and the importance of doing and being involved in a meaningful occupation as a way to hold on to sanity, to a sense of security, to a sense of purpose became so evident. I'll continue with the timeline. On October 11th, we got a heartwarming message from AOTA with a wonderful note saying, we stand with the first responders and healthcare professionals in the region, and strengthening the idea that we support, that occupational therapists support the healing, recovery, and resilience of individuals. About a month later, we also received a statement from WFOT mentioning the saddening of the devastating events and condemning the circumstances that infringe on the right of people to engage in meaningful occupations. I'll go now back to my personal story. So after the first days of frantically looking for what to do and hearing from so many wonderful people around the world, how can we do, what can we do? I went back, I remembered the WFOT Congress, and that occupational therapists really have a strong and important role. And I went back to the materials and started reading and reaching out to colleagues around the world who shared their work. And I found wonderful information about the role of occupational therapy in disaster. So I wrote a little WhatsApp to some fellow colleagues saying, I'm starting to learn about it. I'm happy to share what I found tomorrow evening. If you want, we can have a Zoom meeting. So that turned into a webinar where 300 occupational therapists arrived to this webinar, and I understood that thirst for knowledge and seeing what exactly is our role here beyond civilians. And I'd like to share a few of those key points with you now, and then I'll tell you how we progressed as a profession, as a team. So first, the first step in this webinar was to provide some definitions of what's happening. We were all still in very deep shock. So the definition of disaster is an extensive damage and upheaval impacting numerous individuals and community in the short and long term, where from our OT lens, a disaster makes everyone disabled. We're unable to perform our most basic actions that have defined our lives. And I think we felt that, whether directly impacted or also from afar. And putting into some buckets helps sometimes to conceptualize and see what our role is. So I'd like you to look at this from your OT lenses. And disaster preparedness has 4 parts, and each of them has a very important role for occupational therapists. I'll talk about prevention and preparedness, although we did not have time for that in this event. But prevention begins with understanding our populations, the people we work with that are often vulnerable populations with disabilities, with special needs, and they need different or adapted education and knowledge provision, assessing their risk and vulnerability, and adapting infrastructure. For the preparation step, as occupational therapists, we can devise relevant emergency plans for the populations we work with, whether they might have limitations in their mobility, sensory, cognitive areas. We can develop training and practice for them, for the teams, and think about what would be appropriate warning mechanisms. And then in terms of the reaction, the occupational therapists as health providers, we all have our, hopefully not lapsing CPR training, and we can help with that. But we found that many occupational therapists provided psychological first aid, which we learned how to do to help people that had just experienced trauma to stabilize, to ground, to become, to come back to themselves. Lots of thoughts about evacuation, shelters, and how to care for large masses. To this day in Israel, there are 120,000 displaced people and over 3,000 wounded. Those are masses that Israel is not used to. And then I think now we're stepping into the recovery and rehabilitation stages, partly, not completely, and it's about rebuilding health and wellness, including the services that are needed. And there's the physical and emotional rehabilitation that's going on, but a big part of our thinking should go into rehabilitation of lifestyles and sense of community, that many of those were disrupted. In the 2015 book, Disaster and Development Occupational Perspective, Rushfield and Thomas talk about the role of occupation in disaster. They list 6 principles. I'll talk about 3. the first, and I recommend reading the whole book, of course, but the first principle in this framework is that occupation has a transactional relationship to context. It's shaped and is shaped by the context of disaster. So disaster disrupts the occupations of everyday lives, the social structures, the relationships, the routine. That's something occupational therapists understand and can bring distinct value into correcting, into finding new solutions. Principle 5 is occupation is symbolic and transformative medium. It influences patterns of thinking, doing, and interaction. So following disaster and trauma, people can regenerate positive life experiences, which at the beginning seemed unfathomable. How could people escaping such trauma, horrific events, losing loved ones, can ever think about a positive life? But we saw so much bravery and so many examples where someone spoke of the occupation, of the doing, of the meaning, and how that instilled hope and helped them regain a vision of a positive life. And principle 6 is that occupation holds therapeutic value that heal humans and social systems. It facilitates resilience by enabling options and avenues for development. So healing and recovery from disaster and trauma is not a matter of fact or something that just happens, but it involves a process of adaptations, and occupational therapists have a distinct value in this. One last theoretical slide that was so helpful for our OT colleagues on October 12th is that we still can use our person, occupation, and environment lens to understand our role in disaster situations, where we start with identifying the performance strength and problems. We assess the occupations and the tasks. We assess the performance components and the environment, and finally come up with some kind of unification and integration of this information to this transactional framework. And going back to our base has been very empowering for us to realize our role. So following this webinar and the emotions of remembering our role, and that we have a professional role more than just civilians, I opened up a WhatsApp group for people who are interested in continuing to learn. This was on October 14. And within the first 24 hours, 1,000 occupational therapists and students to join this WhatsApp group. Quickly, we divided into some working groups to discuss specific topics, such as working with displaced populations, developing training, creating a website, organizing knowledge and translation, resilience development, thinking about occupational therapy and yoga was one of the groups, and advocacy and promoting OT. And still is an ongoing group. It's much quieter now, and it serves as a space for sharing relevant information and immediate consultations. Here are my wonderful colleagues that joined at the first moment, jumped in, and were also a huge support group. Shimona Levon is from the Ministry of Health and Sheba Hospital. Ronit Livne is an expert in home health and mental health. Dr. Sivan Regev, who's also here, is co-editor of the Israeli Journal of OT with a broad expertise in mental health and communities, and also with creating infrastructure. And this is me. So Sivan set us up very quickly with a website that was equipped with tools for gathering, arranging, and facilitating access and information, because there was so much information coming out from the group. And thank you to Orna Kochav, who's here. We learned about how important the orientation to time and place is. So every day we updated the time, what date it is, Hebrew dates, and how many days of war today. It is 149 days of war. It's still 24 a week. And here you can see the categories that we have in the website. I'll show you a little bit more about each. So we created a collaborative database using an online bulletin board, using the Padlet software. And you can see here, each of these is like a folder with more information. The first one is additional literature, research, guidelines. We have specific information, pediatrics, older adult people with cognitive delays, disabilities, information about trauma-informed care, and about supporting resilience for therapists. resources for clients and therapists for support and access to information. Here we have a column that's dedicated to Kamel Gat. There were many publications and writings and activities still ongoing, together with the Bring Them Home movement. And also, there were more and more publications on occupational therapists, including Osnat Kraus and Orna Kochav, who's here with us, and they're survivors of the October 7th attack and taught us so much about the needs of the survivors. And recently, a new column with resources is a wonderful one about returning, mostly dedicated to soldiers and people who have returned back, and how do they readapt to roles and routines and into life. We also had what we call the war diary, lots of information gathered from people who were boots on the ground and learned from experience, reinvented our services, whether it's with people with trauma, displaced populations, pediatrics, people with disabilities. We also collaboratively created and shared information sheets for managers on how to provide sensitive and empowering management to prevent burnout, which was something that we felt often. In November, we partnered with occupational therapists in our 2 associations in Israel to write a position paper on the role of occupational therapists in disaster preparedness and response. It was published in December in the Israeli Journal of Occupational Therapy in English and open access. Although there are some position papers, the unique situation that we were in is that so far we found the information was mostly by occupational therapists that flew out to a disaster far away while their families and homes were safe, and they knew that they'll return to life as usual. Here in Israel, we were in a situation of shared traumatic reality where the occupational therapists themselves were in a disastrous and emergency situation. And one of the most important components was, how do we protect the teens who are constantly exposed to trauma and in fear for their lives, especially at the beginning. We were also so fortunate to take part in this, in a collaboration together with the Ministry of Health and our 2 associations, to offer a lecture on trauma-informed work in the shared traumatic reality and emergency, to give our providers some tools that were practical to manage their own burnout and stress together with their clients. Sivan Regev, the amazing Sivan Regev, also established a social media advocacy group that's active on Facebook and YouTube and Instagram. This is our icon, OT Israel, and occupational therapists from universities, from all the universities, and from the field wrote information pages, short and to the point information pages for clients and also for ourselves on occupational balance, on managing time and routines, on trauma-informed care, on telehealth, and some other helpful materials. One of our most recent endeavors that was very moving was on February 5th. This was initiated by the Ministry of Health. And it was a very moving night where we heard a little bit of case studies and stories of the amazing initiatives that occupational therapists have done in so many different populations, really creating new solutions to the needs of clients, from young infants to older adults all across the country. Summary and conclusions. Occupation is resilience, and our role as occupational therapists became so important and clear during the war. I've also learned, and I think we all learned, and we see this tonight or this afternoon or tomorrow, that we have a strong professional community. It's adept at coming together for support, analyzing needs comprehensively, and crafting a multitude of diverse solutions that are so needed and there really isn't any other profession that can offer them. And finally, our strength is in our unity. So I'm so appreciative of of coming together tonight or this afternoon. Thank you all. So thank you for the support and participation. We wish for peaceful days and the swift and safe return of all captives and soldiers. This is the link to our website. This is my email. I'd love to hear from you. Here are the resources that I shared. Thank you so much.
Thank you so much, Liat. That was really such an eye-opener. Thank you for opening the sessions tonight for us. Now we're going to hear from Zurit. No,
I'll try to share.
oh, 1 second, sorry, Zurit.
I was still muted. Hi, everyone, and thank you for being here. Just a minute. I was looking at your presentation, Liat, and I couldn't help but noticing the choice of photo that is very, very similar. And I think it's not a coincidence in many ways. One thing is that I'm part of the amazing virtual community that you created, and probably the icon of the flower just somehow subconsciously infused with my experience of those last few weeks and months. But also this photo was just taken outside the hotel where I was working with people that were evacuated from their homes, and that is just something that was very stayed with me, this small yellow flower. So, hi, my name is Zurit. I'm an occupational therapist in mental health for many years now, and I work in Mazor hospital in Akko, North Israel, and I'm speaking to you now from Tivon, which is also in the north. And as a part of a multi-professional team of mental health professionals, I was involved in the first line of response to evacuees for displaced people that were evacuated from their home, many of whom had left their homes under fire and were accommodated in hotels around the country. The team that I was head of, I was in charge of the multi-professional team, was sent to Jerusalem to support evacuees with symptoms of post-traumatic stress disorder during the first month of fighting. I will share the experience of treating a diverse population that faced personal and shared traumatic experience. That is a phrase that we will use probably a lot this evening or morning. Dealing with the feeling of displacement, with their daily routine, with getting used to their new lives, which unfortunately are still not back to normal. So after one-day training, the team, we traveled to Jerusalem, from North Israel to Jerusalem. Why were we sent there? Well, I guess logic wasn't involved in decisions at the first few weeks. All the psychiatric centers were assigned different hotels to cover, different areas to cover, and we were assigned to Jerusalem. And we were sent to respond to the to three hotels, three very big hotels in the Sim Line area in Jerusalem. It's important, and I'll explain why later. About 3,000, 4,000 people were housed there. On the way there, it was late at night, and my mind was very busy with questions and worries about what awaits us there. And I was also very concerned about what I'm leaving behind. My home, my children, my team at the hospital I work in. The mission ahead was very scary. And the threat the northern front will open, which is still an everyday threat and is very still very we can feel it every day now. We can hear the explosions every day. I'm very skilled and experienced in treating people with post-traumatic stress disorder, but this felt very different. I felt that I'm in danger and my home is in danger, and I did not know what to expect. I did do something that might seem similar at 2006 in the Second Lebanon War, when I was working in a general hospital in Haifa, and I did give mental health aid under fire, but still that was very different. What am I leaving behind? That was one of my main concerns at this long drive to Jerusalem. My team is also in an uncertainty and complex reality. You can look at them. Very diverse team. I have an amazing team. All the wonderful people, women you are looking at are occupational therapists. Some are Muslims, some are Christians, some are Jews. And they are very, very close and tight, and we share each other's weddings, and we share each other's pain. And at every time there is something like this happens, it shakes the core of our being. It shakes everything, but still somehow this team manages to keep it professional and keep the friendships going. But as I was leaving them, I couldn't help thinking, what will I find when I get back? Many of them have their husbands recruited, sent to the front. Some of them have families in Gaza, Arab families that are in danger as well. And it was so complicated. We arrived at the hotel after midnight, and we found, despite the late hour, a lobby full of dizzying and unclear activities, piles of donated clothes and toys, young children who didn't go to sleep yet, families, individuals, volunteers, hotel employees, all in chaos. Unbelievably noisy lobby. And I immediately felt that maybe I'm actually overwhelmed because of the noise. We went to our rooms and decided to meet first thing in the morning and start working, and split to 3 teams because we were covering 3 hotels. We got a room to hold meetings in the next day, and we divided into several spaces with curtains, but gradually realized that we have to change our approach, because this is not a hospital and these people are not hospitalized. They are just ordinary people in a very, very extreme situation. And we realized that a significant part of the most meaningful interactions will take place in the public spaces. And for some professionals in my team, this was hard to realize. The flexibility that was required was very challenging for them, because I was the only OT in the team. Everybody else were psychologists, social workers. We have 1 art therapist, but these are people that are very used to working in a setting. For me, flexibility is kind of part of my professional DNA, but for them it was harder to realize that this is what's needed now. The concept of short-term intervention is also very new to them, to some of them. And when we intervene in acute stress disorder, it is a short-term intervention. It has to be. It's the best thing to do. It's researchers show that it's the best thing to do. It's 1 to 5 meetings tops. And these are professionals, excellent professionals, but they are used to longer interventions. We decided to stay with our name tags at all times, at meals, while staying in public spaces, in the lobby, in the elevator, and in general. most of the conversation would start with someone approaching us and saying, I don't need therapy. Some of the most meaningful interactions we had started like that. Some interactions will take place in hotel rooms. That is a very extreme change of setting for us, because this is people's bedroom, but they have no other choice. They have no living room, and some of them will not leave their rooms because they're too scared right now. Many hardships are spoken through pets and through children. They were allowed in our hotel to bring their dogs, and that's special because some other people had to leave their pets behind. And they would sometimes say through the dog can't sleep, he's very anxious, he has nightmares. And that was actually a way to express the distress they are experiencing. In the hospital, we are used to meeting hospitalized patients with major diagnoses. Here, we had to be careful, and we had to try and normalize to avoid labels. We meet people with difficulty sleeping, with anxiety attacks, with uncertainty and great despair. Different ways we were used to normalize, to help them ground, regulate symptoms, return to life as close as possible to normal, which is very challenging. I found that as an OT, I had very good tools using sensory ways to ground and to regulate symptoms, which were very effective. For the residents, for the evacuees from Sderot, the cultural context is important to understand. I said that we were in the seam line area in Jerusalem, which is between East and West Jerusalem. And that's important because some of them, I come from working in a mixed city with a very mixed team. And I'm used to hearing Arabic all the time. The place I live in is, I hear the muazzin all the time, the call for prayer in the speakers all the time. It's part of my daily routine, but for some people that came from Sderot, the sound of Arabic was scary. And I had to be non-judgmental about it and just accept it and help them deal with it. Muazzin was threatening to them. It was hard to convince them to leave the hotel, to go shopping for the basic things they need. And some of them just couldn't do it without someone being with them, a volunteer or a professional. Another thing was, Liat talked a little bit about the shared reality, the shared traumatic reality, and that was very, it was a major part, because I was taught that when I'm helping someone to ground and to recover from exposure to trauma, I have to say that the event is over. We are now in a safe place, and we were not in a safe place. During 2 meetings that I was holding with 2 different people, sirens went off and explosions were sound. At the beginning of the fighting, Jerusalem also got hit. No one was injured, but still it was very, very scary. And one day, as I just convinced a woman I was working with to leave the hotel and go shop for basic things she needed for her baby, that day there was a stabbing terror attack right outside the hotel, and people were injured. One was killed. It was very, very scary. So I could not say that we are in a safe place now. I could not say that confidently. Still, we did try to help people restore their independence and autonomy. I had to teach my team to ask a basic OT question, to ask the people, what would you do if you were home right now? Because it was very easy, if someone needed something, to just do it for them, to help them, to get a volunteer to do it. Like if someone needed to renew their prescription for medication, for regular medication, so immediately we would find someone to go to call the HMO to go to the pharmacy. And I had to say, wait a minute, we have to let them go back to taking care of themselves. Ask them, what would you do if you were home now? And go through it step by step. If they do need something done for them, that's fine. But as much as they can, let them be independent. Just a minute. Sometimes it was just possible to convince people to go back to independence partially, but still it was better than nothing. A big part of my work was coordinating and synchronization with other people working there. Several entities operated in the hotels. We come from skilled systems, all of us, but into a new situation, and we need to operate with each other and with other organizations that are new to us. We, as representatives of the Ministry of Health, were given a mandate to coordinate all mental health care in the hotels in cooperation with the Ministry of Education, Welfare Services, Psychological Services, Chosen, which is resilience, it's the organization that gives first aid in Sderot, the volunteers of Lev Echad, the amazing volunteers of Lev Echad, and Homefront Command, the army. We created a forum, established referral methods for intervention, registration of people, and coordination. These were by far the most amazing people I ever met. Working with them was a privilege. The people you see in this picture were just unbelievably dedicated, and it was so amazing working with people like them. This is a huge part of the little flower in the sidewalk, of the little light that comes through the cracks when something so big is broken, like happened in October 7th. I've been privileged to work with them. Very grateful for that. Who takes care of us? After 2 days, I realized that I'm not doing a very good job of taking care of my own team. So who takes care of the caregivers? Apparently not me. Someone in my team actually got really dehydrated because he forgot to drink. We were exhausted, very overwhelmed. We were hearing story after story of people that went through very difficult experiences, and the sadness was weighing on us, and it took a toll. We realized that we are not okay. So we built a schedule. I started being the OT of my own team. We built a schedule that includes rest and meals, and we stick to it, everyone except me. We shortened the evening sessions. We had an evening meeting of sharing the experiences of the day with each other, and we realized that this is not doing us good. It might sound weird because you think that you should be sharing your experiences, but this was not the time to do it, and we needed a time to rest. So we shortened the evening session to leave time to breathe. We received guidance from home quotes, because it wasn't really. We received the supervision meetings in Zoom from our hospital manager every day. To reduce the feeling of being overwhelmed and trapped, and the feeling like stranger wouldn't understand what's going on here, the capsulization of a team working in such an area. And we started to sing every night. We took a guitar and went down to the lobby and started singing. People would join us. We were never alone. And that was very exciting and emotional, and very good release of stress for us. In the next few weeks, after 6 days, the group returns north, and I stayed there. I was staying Shabbat. For those of you who are Israelis and serve the army, I nisharti Shabbat. It means I was left behind until the baton was passed to this on the next Sunday to the next group. We manned the hotels for 5 weeks, and gradually there was a decrease in necessity, and we transferred more and more complicated cases that needed longer intervention and couldn't just be with the short-term intervention to the HMOs and to Hosen. The following groups we sent there were smaller, and I would keep escorting them through Zoom meetings and through WhatsApp groups, and I would always be somewhere in the background. This is the first team that you're seeing in the picture at the last day before they are leaving me there for the weekend. In conclusion, I came back in the 5th week. I stayed there for another 8 days. I entered the lobby and I was so shocked because we were a small group this time, just 5 people compared to the 12 in the first week. And the hotel lobby was quiet and clean. The children were in daycare, and some people have moved on to other solutions of housing. Some have returned to employment. People have accommodated, we have accompanied in great distress. We're already in a different place personally in terms of coping. Some even took roles in the community. The initial trauma intervention was over. The acute symptoms are almost absent. There is a lot of talk about the uncertainty, about home. Is there a home to return to? When will we return? Do we even want to return? That is still a question for many. And the challenge now for me was how to say goodbye to the other teams working there that I was very attached to. It was very hard. It was very hard to let go, and to transfer the cases that we were taking care of to the HMOs and to Hosen through tables and follow-ups and all kinds of registrations, but still just to let go and release. I think this was a very, I think it was a very hard time for me personally, but I'm so glad that I had the privilege to take part of that as a caregiver and as an occupational therapist. Thank you.
Thank you so much, Zurit. Thank you for so eloquently showing how you brought yourself to your OT response. It was both informative and very moving. We're going to move to Sigal now, please.
Do you see? 1 second. You see the presentation in full? No, you see the presenter's mode?
Mm-hmm.
1 second. I thought I read it correctly, but it's always wrong. Is that okay? Okay, perfect. So, hi everyone, and thank you for being here today, tonight, this morning. My name is Sigal. I'm a very proud OT. I have a PhD in rehabilitation sciences from Boston University, and I am the director of personalized services at JDC Israel Unlimited. So first of all, I would like to thank the organizers for the opportunity to share our experience and insights regarding the development of social innovations, especially during these difficult times. Because what we have learned in the past few months is that what we do in times of peace can make even more impact in times of national crisis. I will share with you today some of the projects we initiated at the JDC over the past 4.5 months to support the many displaced, traumatized, and wounded people across Israel in order to enable meaningful and safe functioning despite the situation. Occupational therapists have been key members in our development team. So thanks to them, I can share all this work with you today. So first of all, I would like to orient you to the JDC. It is the largest Jewish humanitarian organization worldwide, operating since 1914 in over 70 countries. JDC provides a safety net to Jews in distress, reinforces and builds communities, and provides welfare and rescue services for all people, Jews and non-Jews, in times of crisis. JDC operates as the social development hub, working in a strategic partnership with the Israeli government. Together, we work to strengthen the social future of all citizens in the state of Israel. Our target population includes the most underprivileged in our society, like children and youth at risk, older adults, those living in poverty, and people with disabilities. We do not only work for these people, but we work with them to identify the gaps and the most relevant solutions. And we did a lot of that during the past few months. Within JDC Israel, JDC Israel Unlimited is a branch focused on achieving equal opportunities for people with disabilities and maximizing their autonomy and independence. Our main partners in the Israeli government include the ministries of social services, health, education, finance, justice, and many more. In addition, we work with people and family members, other NGOs in the disability space, the business sector, and other partners too, in order to increase people's sense of independence and autonomy, their sense of belonging, and their resilience. Now, you've heard from Liat and Zurit how important this was during the war, even more from times of peace. So in Israel, there are 1.7 million people that identify themselves as having a disability. This means 18% of the overall population has some kind of a disability. About half of them are adults in the work age range, but only 13% are eligible to receive services, which means about 500,000 people have either never applied to receive benefits or services or have a disability below the level of eligibility. People with disabilities and their families who have who are not usually using services from the welfare or health system or rehabilitation or other supports during normal times might find themselves in need for help during crisis. So during the first week of the war, I think Liat mentioned it, 130,000 people were evacuated from the north and south of the country. Many of them are still displaced from their homes. Although we know that statistically 18% of them were supposed to be people with disabilities, only 7% of the evacuees fit this group, due to challenges in organizing an accessible vehicle or setting them up in a suitable residency. Those who managed to evacuate were rushed into hotels and set up in places that did not fit their needs and were far away from their support system. For example, we received information about an evacuee living in a hotel who couldn't move from her wheelchair to the bed. The transition was just wasn't safe for her. So she slept in her wheelchair for 2 weeks and used wipes instead of showering. We heard about it about 2 weeks after she moved to the hotel, and we tried to help and figure out how to support her. Many people left their supportive equipment behind, as well as their medications and other necessities. The welfare system was occupied with managing all the evacuees, and many of the providers were also displaced, and this led to a great chaos. Many people with disabilities decided to return to their homes, even when they were not safe, because they couldn't function in the new environment. However, most people with disabilities live in places that do not have a safe room inside the house and cannot make it to the public shelters in time. And that is if the public shelter is accessible. As you can see in the picture, that's not the case in many places. As a result, they stay in an unsafe environment with no ability to protect themselves in case of a missile attack. In addition, the Homefront security app developed for the general population in Israel triggers an alert whenever there is a security threat based on the person's location and sends people to shelter themselves. However, this life-saving app is not accessible enough for people who are deaf and blind, or for people who do not use smartphones. Even though the app uses vibration, it doesn't help if the person is asleep and has the phone next to their bed, or if they are in the shower. So about 2,000 people with disabilities are estimated to be included in this group. So since October 7th, we have harnessed our knowledge at the JDC and experience to evaluate the needs and develop solutions that will ensure the safety and independence of people with disabilities across Israel, despite the situation. We worked hand in hand with the ministries of welfare, health, justice, treasury, and local authorities to rapidly scale the services and provide relief to those in need. Adapted Homes is a program offering professional occupational therapy help to allow people with disabilities who were displaced from their homes become more independent and safer in their temporary environment. This includes an online evaluation of the environment and the personal needs, providing recommendations and working together with the relevant authorities to make sure the person receives the assistive devices or technologies they need. The Safest Place is a program we developed together with the Homefront Command, including the training of military officers to consult people with disabilities who chose not to evacuate from their homes on how to ensure they have a safe and accessible space inside the house. This includes providing equipment like handles and bars, or adding lights to allow quick and safe access to the most secure area, which might be the hallway or an inner room. But at least it's the safest that they can, where they can be. Our team of occupational therapy experts in adaptive technology supported the development of a bracelet that provides the optimal safety solution for people with hearing loss or blind, that can also be used as a replacement to a smartphone app. The bracelet is waterproof and can be used while sleeping or in the shower. It provides alert using sound, light, and vibration, and also provides indication when 10 minutes have passed to let people know they can unshelter. So this was a rapid development that we made. As for trauma, we heard a lot from Zurit about the trauma. According to the Israeli Society of Community Mental Health, more than 600,000 Israelis will suffer a permanent damage to their mental health due to the war. This estimation highlights the need to use preventive measures and quick support, but the availability of services and professional providers is limited. In addition, it is very hard to find information about services that do exist and identify the most relevant, effective, and valid support. Within the first month of the war, JDC Israel Unlimited launched a website that organizes all the mental health supports available throughout Israel. After screening them to ensure their validity, tag them by audience, geographic area, and expertise. And this dynamic database is currently holding almost 300 services, and it is being constantly updated. The team includes occupational therapists, social workers, and psychologists that evaluate and tag the services to ensure quick and easy access to the information. We have also identified new populations that need our attention during this time in order to prevent a much more severe disability. The first project, called the Quiet Room, was designed in collaboration with the Occupational Therapy Department and the Ministry of Health. And Liat mentioned Shimona, who's a dear partner, working with us on that. And the quiet room worked to reduce stress and increase self-regulation of evacuees living in crowded hotels. The design is based on a similar concept used for people with ASD in crowded festivals. And a small space is allocated in the hotel where people can take a break from the chaotic atmosphere, the noise, and the high intensity. The rooms are designed to allow self-regulation so people can feel more relaxed and in control, using heavy blankets, soft lighting, noise-canceling headphones, VR glasses with relaxing scenes, and other elements. They are operated by people from the displaced communities who are trained and supervised by occupational therapists. People can use the room for 20 minutes to relax, be alone, and regulate the sensory overflow to reduce the stress impact on their health. Lastly, Israel is dealing with a vast number of newly injured people. Most of them are very young, who will need to go through a long rehabilitation process. It is currently estimated that at least 2,000 people will remain disabled due to this war. While the medical system provides excellent care, many people are having a hard time rebuilding their lives with the new disability status once they move back home. Unfortunately, the various systems that should provide support in the community are not synchronized, and it takes a lot of effort from the person to exhaust their rights and weave their support network in the community. Returning Home is a program designed to support soldiers and citizens that were recently injured as they move back into the community with the help of a person with lived experience. This person has the knowledge and personal experience and can provide the needed support to deal with the endless bureaucracy, to organize the daily schedule, to rise again when you fall, to identify the needs, and to find the most relevant solutions. We are currently in the process of developing this program together with the Department of Rehabilitation at the Ministry of Health. The work we have done over the past few months allow us to share a few insights with you today. So first, we learned that what works in time of peace can be applied with minor changes in times of crisis.
This is OTs of Israel talking about like doing OT in times of...
Someone has their microphone on, so if you can please mute yourself. Thank you. Second, occupational therapists can make those adaptations very easily by converting interventions and solutions from one population or environment to another, because it all comes down to functioning. Creative thinking that involves people with disabilities and their families brings the most impactful results. We really work hard to sit together at a table and design the programs together. And lastly, collaborating with the government, the private sector, and NGOs allows quick development and scale. I would like to dedicate this talk in memory of two young girls living with a major disability and their family members. Both families were known for their strong bond and strong will to live their lives to the fullest, despite the disability. Ruth and her father, Eric, were brutally murdered while partying in the Nova Festival. And Noya and her grandmother, Carmela, were killed in Kibbutz Nahal Oz. May they rest in peace. Thank you very much. You have my email here if you would like to reach out and learn more about the projects that I described. Thank you.
I think I'm up now. Can I share my screen with you guys?
I think it's me. It's Ona. I'm trying to share screen.
Okay.
Am I right? רגע, אני לא מוצאת אותו. לא מצליחה להעלות את זה. Just a minute. אני לא רואה את זה. הקונס, רגע. אני לא מוצאת את זה. תמר?
תעשי exit full screen, ואז תחפשי למטה את ה-share screen.
אוקיי, עשיתי, ואני פשוט לא יודעת למה אני לא רואה את המצגת שלי. שלחתי לתמר כדי שהיא תוכל להעלות את זה גם מהמייל שלה.
אורנה, יש לך שם show all windows, יכול להיות שזה יותר למטה.
I don't know why, I can't find it. רגע. אתה יכול לעזור לי? Sorry. Yesterday I tried it and it was okay. רגע, just a minute. I'll do it again. אני לא רואה את זה.
הצלחת לפתוח את החלון של השאר?
אני מצליחה את השיר. אוקיי, sorry. And is now it's okay?
Yes.
מצוין.
Great, thank you. Okay, my name is Orna Kochav. I'm an occupational therapist, and for me it's really strange to sit here because I feel part of the lectures are talking about me as being at October 7th in the safety room. So first, who am I? I'm an occupational therapist. I work at Soroka. It's at a rehabilitation ward. It's a medical center in Beersheba, and also I'm a co-founder of Shlemim Center, which offers rehab services for adults in the Negev. It's the part south of Israel. I'm a survivor of October 7, and I live in Nachal Oz. Nachal Oz is a kibbutz really adjacent to the border. It's around 800 meters, like it's a half a mile from the border of Gaza. And on October 7th, we were sitting, we've been 15 hours in the safety room. I was with my life partner and my daughter that is 19 years old. Now she's in the army. And we had electricity, we had Wi-Fi, because part of the kibbutz didn't have anything. That means that if they don't have electricity, they don't have air condition, there's no air. Part of the day, we didn't have any water and food. And but what I want to focus on, and I'm sure you heard a lot of stories, I want to focus on what helped me. How to cope with these 15 hours. First was limited information. We didn't understand at first the vastness. It took it until today. I don't understand the vastness of what happened. Today we hear stories like part of the soldiers that came to Nachal Oz. They went to Gaza and now they're coming back and we're hearing their part. So I feel I'm still feeling the puzzle. But for me not to know the vastness of the failure, the vastness of the Hamas attack on this Saturday, it really kept my sanity. And I know that many people that have no direct connection, but were exposed to hours of news and social network and Telegram, really show a lot of acute distress. So I think limited information, and I found also for our patients, we need to think how much and when to expose them to, and to which information. It was a lot of hours of stress, and what helped me is like I felt that I can't be in so much stress. We really played games, and we had like a lot of distractions. Like even in our minds, we went to all museum tours or tours that we went to Europe and the States, and not that are not to be like all the time at the mamad, at the safe room. So in my mind, we went out on what to focus. I know that you need to understand that when you're sitting in the safety room, we were bombarded with so many kind of noise, is gunshots and RPGs, and there's the bomb alert and the bombing falling and rockets, and some people, I know that they were trying to understand if it's the IDF or it's the Hamas, and I felt that I wasn't, I made like a kind of a bubble. I didn't care if it's neither. I wasn't like looking at it, and I felt that I'm trying to focus on what can help me, what can help me moving the time. And we were a lot of we let a lot of our families all the time and friends what's going on with us. So that's what we focus on. And I really, if somebody asked me if I know what's going on, and I said, I was really like again, I was like very much limiting the information, as I said before. I wanted to stress another point: the hell inside and the hell outside. The hell inside, I mean, that sometimes you need to look at people that there was any physical danger. But like many kibbutzim, the Hamas didn't get into the kibbutz. But for them, they were feeling and perceiving that they're in danger. And I know a lot of families, they was thinking for hours where to put the child, under the bed or in the cupboard or anything. So we need to pay attention to those people also, that they were in stress for so many hours. Circles of stress and trauma. I know that many people that I can tell about my family, part of feeling in being in trauma is that you feel helpless. And my families, my brothers that were far away, and that they couldn't do anything. Really, like felt it's such a toll that they pay about like for hours figuring out if we are okay or not. So thinking that so many people are, when there's such a vast trauma, they are influenced from it. And we need to look at all kinds of people, and we need to, and we can miss them because they have no direct connection to the trauma, but still they are very much influenced. The first week, we were in shock. And you need to understand that when we left, we evacuated by the army a soldier came to me and he said, you have 2 minutes to pack your things. You need to go light. And they escort us to a gathering place. And after 3 hours there, we left with nothing. We evacuated from the kibbutz. All the kibbutz was evacuated. It took us time. Many people took us more time because the chaos was enormous, and we evacuated by buses. So we left our cars, we left our rooms, and I came with only a small pack, and I bought my computer. But although that if it was a time I would ask you for each one for 2 minutes to think what he would take with him if he has only 2 minutes to decide, and sometimes it's to do it in the dark. What is important for him? I took my computer and a few clothes, and so we went. So we went to a gathering place, and for me it was such a chaos. And I said to my partner that I want to go to my family. We want to go to family. We don't want to go to where our kibbutz is. Our kibbutz, Nachal Oz, is all the years is hosted by a kibbutz, Mishmar HaEmek, that is in the north. So at I think at 2 o'clock in the morning, people they went on buses to the north, and we went to family. And I think it's part of the way that the family coped with the situation. So at first, and I heard of many people, really at first we needed help in the really basic ADL. Like we needed clothes, we didn't have anything. So talked with members of my kibbutz, really to stay, a place to sleep, all these things, the basic were very important. And for me, getting the help from Israelis, it's it really gave us hope, because I got so much help, and with so much generosity, and it's still amazing me. Somebody gave us a house with his car, for a few days, that we can have a place. People really went out of themselves. I want to emphasize 2 things that in this first week, the really disorientation, because I think when all your beliefs in safety, on right or wrong, or what can help us, it's shattered. I think it's really it's stirring your conscience. So I think if you find some, and if you live in some, you're going out, I see that you call it the displaced. I don't feel that somebody puts me in a different place. All my surroundings is really broke down, and we need to build it in a different place. And I need to find something in myself, something that is I can count on. And that's what I felt in the first week. What is the home? Is a place that you can go back, and you know your things are there. What you planted, decided, it's your safe place, and now you don't have it. So you have to find a small home, a small corner, something that can that you are responsible, that can give you a sense of control and sense of security. Another thing that I felt that it's very important is that the idea that any feeling, behavior is legitimate. I'm not talking about harming myself or others, but nobody can say if it's okay to how I grieve, if I laugh, and when you're giving yourself this you're giving it to yourself, it's really freeing. So I want to continue because we are 5 months after the event. I want to say something about Soroka. Soroka is the work where I'm working, where mainly is where I'm working, and Soroka on October 7th, like it was really in the middle of what's happening. More than 700 people got injured, got into Soroka. Staff of the staff of Soroka is part of what's going on in the south. Many people are working when their children, when their husbands, wives are in the shelter. So can you imagine how is it that you're part of it? Also, we opened in 4 days a new ward, and I can say for the occupational therapists, like they're really, in my colleagues, that really also back me up, and really we recruited to this mission to with the same power of people, and we like treating like double the amount, and it's really difficult, but still. So after 3 weeks, you understand, the first 3 weeks we were a lot in funerals and shiva, and so I came. After 3 weeks, at the end of October, I felt that I can come back. What helped me is coming back gradually. I had the backup of my boss. Really, she gave me such a backup of taking time. I had like fewer patients, and I felt a lot. I could understand our patients in a different way that I never thought. And I felt that I need to accept that I'm not the same. To be a refugee is when you're coming and you don't have a home. When you're coming, it's really, I don't want to say it's not easy. It's like it's shaking, but still, like for me to come to Soroka was coming home. I know the place, I know the people, I have the, so it's really helped me. And I know that people can relate of shared trauma with your patients when, from the COVID time. So when you and your patients have, I felt it's like a joint destiny. At first, I didn't. When I came back, I said I want to treat only patients that I treated before, people after stroke, and I found that treating the soldiers, I can speak their language. We have the same understanding. I want to relate to what Zurit said about the Arabic. If you hear for hours Idbach al-Yahud, the thing that you're really afraid of Arab people, and I can understand how people really afraid of meeting Arabs, and I know that because I'm working with staff that are Arabs, and because part of my patients are Arabs. I took my 2 daughters and we went to Jaffa, I think 2 or 3 weeks after. And I said, Arabs are part of this country. I don't want to be afraid of Arabs. I want my children that will accept Arab people, and so we really like we made a treatment in exposure, and it wasn't easy. But I said to me, this is Israel. Arabs are part of us, and I don't want, because of Hamas, that I have anything against it. But I can understand how many people, after hearing so much Arabs that means danger for them, how much they don't want, they're afraid of it. And now, after 5 months, or after 4 months, I felt that I'm ownership my situation. I understand that that's it. Like many people lived in hotels or in other commune places, and we decided from the beginning that we don't want to. At first, we tried it, but the kibbutz offered us like a small place, like a room that we need, like me, my life partner, my daughter, and Itai's daughter. So like she's 30. So 4 people in such a small room, we didn't find it working for us. So now and many people in the kibbutzim are really like waiting. What is the next step? And this uncertainty, I felt for us is really unbearable. So we decided to rent a place for a year, and we're not waiting for any solutions from the government or for my kibbutz or for other people. And I felt so by renting a place, I know that I'm far from Nachal Oz, from my home, but for this year we have a place, and it's really taking down the uncertainty that we were living like for 3.5 months. I think you need to accept the situation that you are fucked up, really, because to be out of your home, out of your community, you're paying a price. I think seeking for a solution and from your strengths, and looking on what you have, what are your strengths, what are your resources, what are the people that can help you. I think in this shift, I found it also, it's a key point also with my patients, is it's a time that when you ask, you stop waiting for others to help you, but you focus on rehabilitation, you putting yourself and looking at the future by accepting and not fighting what happened. I put this picture because with my partners in Shlemim, we developed a therapeutic card, and I forgot them, about how to treat executive functions. And when my partner saw that I have problems with executive functions, she said, "Why don't you open the tool that you have?" And I think that a part of rehabilitation is looking on our strengths, what you have, how you can rely on it, finding the hope in yourself. And I think that can taking us further on. So I wanted to say thank you. I wanted to say another 2 things. Many people, they look all right. They say, "Oh, you find your place," but I think there's a lot of limitation that are all kinds of vulnerability, and that you can miss. And I think I see at our patients that have like blast injuries. At first, they really emphasize on the physical part, but now we can see they have problems in cognitive problems, memory, and further on, how to get into work community to learn. So we need to see that that we don't miss them. And another thing I see as working at Soroka with the soldiers, so many people come and helping us and trying with their generosity, giving all kinds of, I don't know, iPads and food. And I think that this help, we need to look what will happen when the war will continue, with the soldiers will be injuries that we need to treat for years, and we need to think of how to find a way that they can have a continuum help in the community, and all the donations that are here, we need to think of really how to use them wisely. I feel that a lot of donations or just throwing on things that now really have minimal effect. So I want to thank you all, and we're praying for Carmel and Keith and all the kidnapped to return home.
Orna, thank you so much. I have to say that you really took my breath away at a few moments in your presentation, and I think you brought a whole new meaning to a strength-based approach in the most real of ways. And I wish you and your family and your community healing. I thought it was really profound, the healing that you found in shared experience with your patients, with your fellow countrymen. Taking your daughters to Yafo was, I mean, that was really profound. And also finding healing in taking control of your destiny. And we know how much strength that must take at the moment. So we send you much love and healing. I'm going to move to our last speaker, Vardi.
Yes, hi. So I'm going to share this with you. Hope it works. Okay. Okay, so hi everybody. Thank you, Orna, for sharing. I'm trying to catch my breath. You're so inspiring, really. It's amazing. I can't even start comprehending just this is what I have to say. I will go on though with my presentation. My name is Bari Rubin. I actually saw my professor online here, so I'm going to say I'm a PhD. I'm a doctor in OT. I work in Sheba Medical Center, which is a very large medical center in Israel. And I work in the soldiers department. So I'm going to explain my gray screen that you guys are seeing right now. First of all, as a typical OT in Israel, I would start by apologizing that my original presentation, I couldn't get it to work. So I had to kind of pick up where I lost last night. The gray resembles the 7th of October, which caught us off guard, shocked, devastated, overwhelmed. So many words can fit this feeling. It was just, we didn't know what to do. It just happened, and we had to start understanding what's gonna be, how we're gonna work with this, what's our goal, what's going on. So we started off. Sorry.
Oh, all right. Let me check who's. I'm just muting.
I'll just continue. So 7th of October struck us. Israel is a very small place. It's about the size of New Jersey, I think. It's very tiny and it's very familiar. So people here have typically children, and their children go to the army. And a typical soldier comes home for weekends. Every now and then they stay in the army, but they usually come home for weekends. So we're all a very small community in a very small area. And when 7th of October came, almost everyone was involved in some kind of way. So Orna told us her amazing story, but people have children in the army, people had children in the party, people had husbands, wives, people that are involved. We were just shocked and overwhelmed. The first days, people just didn't go to work. We didn't do anything. We were trying to understand what's going to be. People were drafted into the army. It was a little bit of a chaos, kind of atmosphere in the air, of shock, of stress, of just people trying to understand what do they have to do today. As OTs, we went to work because we work in a hospital. So a little bit like COVID days, we realized that we're essential and we have to go to work. And doing, as my first fellow speaker said, is amazing. Kind of feel you're doing something, you're helping, you're moving your energy towards something that's helping other people. So this picture is of geriatric department, I would say at the 8th or 9th of October, where the hospital realized they have to build a department to contain the injured people that are now starting to flood into the hospitals. So it started off like this, and I'm going to show you different pictures that throughout the presentation, just random pictures of our daily work in my department. And I'll start by saying what the department is. So our department opened officially 2 weeks after the 7th of October. We had no staff before. It didn't exist. The department was not there. And we had to gather personnel, gather people to work, gather equipment. Look at this place. It's amazing. The first people we got were the people from the 7th of October. So it was either people from the festival, from the Nova Festival that were injured, or soldiers, or civilians from the region that is close to the border. We had a lot of people that were there on the 7th and 8th and 9th of October that came in with very, very bad injuries of the upper extremities, mainly lower extremities, but mainly the extremities. They stayed with tourniquets for prolonged times. So a tourniquet would normally get off after 2 to 3 hours. These people had them on for anything between 8 to 22 hours. And their injuries were very severe. So we'd get a hand with a very bad condition of the nerves that were damaged, that were suffocating. We'd get people that were injured just by shooting or blast injuries. From the 7th of October and on, we also started getting soldiers from the actual fighting. As I said, the first task was gathering staff. So practically what we did, we tried to use OTs that we had in our staff. The occupational therapy department in Sheba Medical Hospital contains 140 OTs. We're one of the largest OTs in Israel and in the world, by the way. And we started gathering people, but we can't just take anyone. We had to take people that understood what to do with these injuries because they were very severe. So we had an overwhelming amount of people that gathered around us and wanted to volunteer and wanted to come and help us. We had people from Israel and people from around the world, from different areas. We had OTs, we had just people that wanted to come and help us, just nice people that offered to come, leave their lives wherever they are and come. So the first thing was to try to say, okay, we need professional help. We had to understand what's the help we needed. So we kind of focused on orthopedic damages to the body, and then whoever is an OT, because obviously I would take only OTs that could work with us. Now, I don't know if you guys know, but Israel is a very small country with a lot of bureaucracy. And to get people to start working in a governmental hospital meant getting them through a whole process of being accepted to work in Israel if they came from abroad, or in the hospital if they're not from one of my workers. And it could take between 2 to 4 weeks. But we did it. So we had a staff that gradually grew and departments that gradually grew. So we started off the first day, we had 22 patients, and we grew into 3 wards, eventually being 110 patients. Okay, and this is besides other rehabilitation departments in the hospital that already existed. So this is a new department, did not exist before the 7th of October, 110 patients, plus about 150 other patients within rehabilitation in different departments that already existed in the hospital. So it's a lot of patients, and this is only in rehabilitation. We're talking OTs, PTs, social workers, doctors, nurses, psychiatrist, psychologist, everything that has to be in a rehabilitation department. We all gathered together and we started working with these patients. Now, I had all kinds of pictures that I kind of showed you throughout me talking. By the way, I try to cover their eyes. I hope it worked. We're trying to think of how we're going to work with them, because these patients presented mainly their physical problems. So they came in, as I said, injuries to their extremities, but they also, most of them came from a very bad situation. So either they came from the 7th, 8th, 9th of October, or they came from battle, which means they were traumatized. All of us were, but they were there. They were in the actual happening of the 7th of October or the fighting. Second, they had sleep deprivation, which also gave them signs. A lot of them came from blast injuries. So someone said that before. Also, blast injuries is practically a concussion that's caused from blast. So anyone that's near a tank that shoots, or anyone near an RPG that's shooting at you. I had people coming in and say they had a bomb blow up in the room where they were, and all their friends around them died and just they survived. We have all kinds of stories like this. So trauma is a main issue with us, and blast injury is a concussion, so that gives the symptoms, as you all probably know. And as I said, orthopedic conditions, and a lot of them are on painkillers and medication. There was just so much, and we had to try to see how we're going to work with these people in an organized manner and not kind of lose our path. So we worked by protocols for the orthopedic problems. We had a whole staff of orthopedic surgeons that would come in and out. They still come in and out of the department practically every day. And then we took all our OT skills and we started realizing that we have to give these people some kind of a daily routine, try to work with their sleep problems, try to work with their appetite problems, try to give them a sense of, I'm okay and I'm here and it's okay for me to be here, because some of them also had what's called survivor's guilt. So I survived whatever happened to me, but my friends are still in Gaza and fighting. And why should I have fun over here? So the whole area of this department is built, it looks like a, sorry to say, but like a men's club. So there's different areas of recreation, and there's a lot of donations coming in, and there's all kinds of artists coming in and performing for us. And I'm not talking about celebrities in Israel and singers and performers. And it's just all the time they come in, and these soldiers are heroes, but they don't really feel like they're heroes. In fact, they made a shirt for themselves that says, I'm a hero. You don't have to keep telling me that. It's because anyone that comes in and says, oh my God, thank you, you're such a hero, and here they are, feel like, A, I was hurt in battle, so I wasn't a very good soldier, or B, I left my fellow soldiers there to work, and I'm here not helping them, and they're endangering the life. Also, I wanted to take into consideration that anyone that goes into battle, so it's not like a movie, you don't go in and you say, okay, I'm gonna either win or I'll die. No, there's another option, and they don't think about that. They don't even, they're so shocked from the actual wounds that they come with. So it's also something that we have to deal with. There's a few other things that we have to deal with. They came with this fungus that no one really understands what it is. It's a fungus that they came from Gaza. So a lot of them are just medicated with a broad spectrum of antibiotics. Of course, also there are different medications for their painkillers and so on. So that's also an issue that we cope with. I want to go back for the OT for 1 second. So as an OT, as I said, we want to try to give them the routine. We want to try to give them as many good experiences with their illness, with their limitations. We use regular OT hands-on, but we also use a lot of technologies. We have something like we have telerehabilitation, we have VRs, we have, I don't know if you guys know, the Miro or the Pablo, different technologies that they use in order to get these young people to participate in whatever they have to do. So if you have a person that has a problem with the wrist and they have to do different exercises, how many times can you do this? But if you give him a PlayStation in his hand, oh yeah, they can do that for hours. So we have any PlayStation, Nintendo, name it, we have it. But some of them don't have both hands to use. So we also have a lot of different groups came into volunteer, as I said before. One of them is a group that does different technology solutions. So we harnessed them and they helped us with different ways how to use a remote control for the Nintendo or for the PlayStation, how they can play with one hand or with just 2 fingers. We have different people coming in to do cook groups. We had like different chefs coming in to do cook groups like you have right now, or we have, oh, by the way, you see this dog? So we do have a few dogs. This is Esty, an OT that works with us, and her dog is one of our staff. They love him. He comes in twice a week because there's some OTs that don't like the hair, but he comes in twice a week and you'd be surprised how the soldiers love him. When I say soldiers, I do have to apologize. We also have civilians. We also have we had 2 kidnapped girls, but now I'll just refer to everybody as soldiers. So the young people mainly between 18, 19 to 35 mostly, and anything that would get them to engage in therapy, we do. So we have yoga, we do art therapy, we do gardening with them. We had a Czech guy coming in and play like in Queen Gambit against all of them. They loved it. We had a photography with your phone workshop. We have different instruments that they can play. We have guitars, we have different drums that they can work, anything to get them to work with their injuries and with their hands and with their limitations. We want them to go home throughout the rehabilitation. So in order for them to be able to go home, we have to make sure that their home is suited to whatever accessibility needs that they have. We do have other organizations that help us with that. So in Israel, there's a lot of organizations just showed up. It's amazing. It's like they called us, they said, we can sew clothes for people that have an external fixator and can't wear a regular t-shirt. We could just do it with clips. Sure, come in. We have something that we can go to a person's home and fix it up that when he comes home, he can access his wheelchair into wherever he has to go. Sure, come in. We have different people that come in and help us out. And it's amazing to see that we had our staff and then we have all these different cycles of people that just are around us and helping us. Today we had a CBT for insomnia person that coming in, a psychologist. He was amazing. He sat with 20 of my soldiers and they told him about their sleeping problems and he gave them tips. That's amazing. Where would that happen? I have to wrap up, I know, so I would like to talk a little bit about my staff. So 1 minute, is that okay? Okay, So as I said, Israel is a very small place, and most of my staff either are connected directly to people in the army or to people that were injured or to people that are kidnapped or killed. Our soldiers also have friends that are still in the army, obviously have friends that died or injured with them. It's a difficult time in Israel altogether, but it seems like we get a lot of our strengths from them. So you work with this young guy and his hand is ripped open and he has terrible damage and he's post-traumatic. And in a second, he tells you his entire story and just sit there and you go, oh my God, he's so young. He's my daughter's age. My daughter has 3 girlfriends that are kidnapped. My daughter serves in Gaza. My son goes in and out of Gaza every day now. He's in the army. It could be my kids. And this is something that's true to almost all Israelis. So my staff, that they work with all these soldiers with all their stories, and they just get it to them every day during treatment. They just tell you, and it's not in a bad way, but it's a burden and it's very difficult. So we had to try to think how we're going to gather them. As I said, first of all, they didn't all come from the same department. They didn't all work in the same place before. So we had to do little tricks to get them to work together. So for instance, 12 o'clock, doesn't matter what happens, we close the department and we all eat together. It's amazing. We sit around the table and we just talk and we eat. We have the daily routine starts on a Sunday. We work on Sundays. So on Sunday, we all gather for 2 hours. We don't get any patients. We talk about the patients. We have psychologists that offer their help, and we see them from time to time. There's different articles that are written about us, different media posted. So we also record our patients. It's a little thing that any patient that leaves us, he has to leave us a little video of what he feels about the staff and what he feels about OT and what's important with OT. And then because I told you they're very young, so some of them have like little jokes, like this one guy would say, oh, please make a video of me. I want to tell you what's the difference between OT and PT. Don't you guys have a fight between you? It's like these little jokes that they have between them. It was funny. And of course, he did not mention that OT does a lot of the things we do, but that's okay. We have volunteers. We have people like this woman in the photo that you see now. We have 2 of our own veterans that came back to work for us, and they each come once a week to work with us. And we had 2 volunteers from the States that came. Thank you now. For Hadassah, Solomon Rosen and Dorita Haron both came for 1 month at a time to work with us, which is amazing. They also taught us a lot. We have a WhatsApp group. We have different WhatsApp group. We do different things for ourselves. We went out a few times as a team. We gather with other teams. We go to coffee. We have this beautiful terrace that they built for the soldiers, and they have like different coffee machine and different cakes and different pastries, and we go there for breakfast. So it's the little things that we do for our staff, just that we should feel together. There's no time, but just like to keep in mind that this is rehabilitation, and our patients stay with us for any time between now and 2 to 3 months. But we really have to think of what's the day after. Some of them don't have a home to go to, or don't have really work to go to because they're in the army and they can't go back to the army, but they're still young and they don't have a profession, or they don't really know what to do. And people their age have different realities right now. So that's kind of the questions we ask ourselves, is what's the next thing? How are they going to re-enter for the other things that they have to do? And that's like the next step that we talk about in treatment. It seems like I forgot a lot of things, but I know that time is a little pressed. So we do cooking, we do vision therapy, we do VR, as I told you before, different electronic stimulations. We have a lot of doctors that come in to consult with us. We do the gardening, just plain OT. This is the last story, and then really I'm going to end. See this big guy over here? So he was injured the first day. He's huge. He's really big. And this little tiny woman over there, she's in the geriatric department. And she came up to me one morning. She said, you know, I'm a Holocaust survivor. And since the 7th of October, I have nightmares and flashbacks of the Holocaust. can I see one of your patients just to make sure that there are really soldiers here that can protect me? And this guy that I asked him, because I know he's wonderful, he sat with her for 20 minutes and he told her how he got injured. And he asked her about her life, how she experienced the Holocaust. And then he held her hand and he said, you know, I have nightmares too. You can come to my room and we can keep each other company during the night when we can't sleep together. It was very sweet. I think I'm done. Thank you so much for listening. Thank you everyone for your support and your time. I know it's early in the morning for some of your people. We hope that this all comes to an end very soon and all our captive people come back, all our prisoners, or our chatufim come back, and we're all whole again, and we start building our country back together. Thank you very much.
Thank you so much, Vardi. It's hard to use the word uplifting around these issues, but I think, you know, the true essence of rehabilitation really came across in this final session, the idea of rebuilding, giving people tools to get back to life after such tragedy. So thank you very much. I'm going to wrap up. I know there are some questions in the chat box about volunteering. So let me just address that. We'll get the information from the Israeli Association and make sure to pass it on to everyone because we have everyone's email addresses and we'll be sending up a follow-up email anyway. I just want to thank all our panelists for their incredible contributions tonight. We named this Navigating the Personal and the Professional after we spoke to Aya, and she spoke about that in our first meeting with her and Yifat from the Israeli Society. Sorry, it's morning here, 7 a.m. So my little one has just woken up. Apologies. I think, you know, we really heard, like I said before, the alphabet of the profession, but like given such elevation through the meaning that you've all found in your work as you try to navigate the meaning of life in Israel and life as a Jew in today's world. And I think that occupational therapy, when we think about doing, being and becoming, you have all given it such strong expression in the work that you've been doing as you navigate your personal traumas and fears and try and find expression for your OT journeys and bring that meaning to other people as well. We know how difficult a time it's been for all of you, and we don't take it for granted that you were able to bring yourselves here tonight and speak about your experiences, both personal and professional. So we really thank you for sharing these profound insights. And we're also really grateful and we're committed to platforming your resilience and power around the globe through our own professional networks and giving you support in what are very hostile times for Israelis and for Jewish people, but especially for Israelis. And we know that that might continue going forward. So part of the idea of this network, which we hope to build, is to really be able to support Israeli occupational therapists once they start re-navigating or re-engaging the world around them professionally. So we hope that everyone here will complete the survey that we've provided so that we can build a network of support for each other as Jewish occupational therapists around the world, but also for our Israeli colleagues. And we have recorded this session, so we hope to be able to also share it once we discuss it with ISOT, share it professionally, and also with the people who weren't able to make it. We had 150 people register. We had pretty much everyone stayed online. We had 75 people come, but we'll certainly be sharing this, your learnings far and wide. So thank you. The survey will appear in the chat box in a moment and will also come through on the email that we send. So just looking if there are any questions here that need to be addressed. Yeah. All right. So thank you very, very much, everyone, for your time tonight attending. And we just wish our Israeli colleagues all the very best. And we also send strength to our Jewish OT colleagues around the world. We know that everyone has very differing experiences and many are not positive in workplaces. So yeah, we hope we can all be here for each other because we're stronger together. All the best. Thank you.
Thank you. Bye-bye.
You know,
Thanks.
yesterday I was watching on YouTube in the morning and I was watching
Yes, Randy, 1 second.
That's the High.
I know, 1 second.
A huge thank you to all the speakers and to those who organised this. What a phenomenal event. An absolute privilege to hear from all of you. Thank you so much. And I hope that we will maintain contact and find ways to support you as well as just listening to you. Thank you.